Hello everyone, it's William back with another video. Today, we are going to be discussing the topic of infections and diseases in the urinary system. Before we get started, I just want to point out that the reason that I am using an AI voice for this video is because the names of some of these conditions listed in the video are super hard to pronounce. Anyway, without any further ado, let's get started. We will first start off with urethritis. Urethritis is the inflammation of the urethra. The most common cause for this condition is sexually transmitted infections, or STIs, such as chlamydia and gonorrhea. Symptoms include pelvic pain or burning sensation while urinating, and increased urge to urinate. Common treatments are either taking antibiotics or undergoing medical treatment, such as surgeries or procedures. Next up is cystitis. Cystitis is the inflammation of the bladder. Common causes for this condition are urinary tract infections, or UTIs, bacterial infections, such as E. coli, female anatomy, medications, and radiation. Symptoms include frequent urges to urinate, pain while urinating, cloudy or strong odor urine, and bloody urine. Common treatments for this condition are drinking water, avoiding bladder irritants, pain relief medication, and urinary alkalizers. Next on our list is pyelonephritis. Pyelonephritis is a severe kidney infection that starts out as a lower bladder infection. The most common cause for this condition are bacterial infections. Symptoms include fevers, flank pain, chills or shaking, nausea or vomiting, and fatigue. Treatment options include antibiotics and medical treatment. Next up is one you are all likely familiar with, kidney stones. Kidney stones are hard objects made of minerals and salts that clog up your kidneys. Causes for these are unhealthy diets and obesity. Symptoms include the inability to urinate, sharp pain below the ribs, pink, red, or brown urine, vomiting, and fevers or chills. Treatments include medication and special diets. Up next is interstitial cystitis. This is a chronic condition that is linked to severe bladder and pelvic pain. Causes for this condition are defects in epithelium, autoimmune reactions, and heredities. Symptoms include severe pelvic pain in the genital areas, and severe discomfort while urinating. Treatment options include lifestyle changes, medications, and surgeries. Next on our list is benign prostatic hyperplasia. This condition is the non-malignant growth or hyperplasia of prostate tissue. Common causes are diabetes, dietary factors, genetic predisposition, inflammation, obesity, and metabolic syndrome. Symptoms include frequent or difficulty urinating, bloody urine, and feeling of the bladder not being fully empty. Treatments include medications, medical procedures, and lifestyle changes. Up next is prostatitis. Prostatitis is a condition of the prostate gland linked to inflammation. Causes for this condition include acute bacterial prostatitis, chronic bacterial prostatitis, and asymptomatic inflammatory prostatitis. Symptoms include frequent or difficulty urinating, dysuria, cloudy or bloody urine, stomach pain in the perineum, and fevers or chills. Treatment options include antibiotics, alpha blockers, anti-inflammatory drugs, and surgeries. Next up is hematuria. Hematuria is a condition that is linked to bloody urine. The most common causes are bladder or kidney infections, kidney stones, bladder or prostate cancer, and glomerular disease. Common symptoms include pink, red, or brown urine, blood clots in the urine, nausea or vomiting, fevers or chills, and abdominal pain. Treatments include medications and antibiotics. Second to last on our list is overactive bladder. This condition is linked to sudden urges to urinate that are almost impossible to control. Causes include neurological disorders, urinary tract infections, bladder stones, enlarged prostate, and menopause. Symptoms include frequent urination, incontinence, nocturia, and bladder spasms. Treatment options include lifestyle changes, medications, and surgeries. And finally, we have dysfunctional elimination syndrome. This condition is usually found in children and is linked to urinary issues. Causes for this are neurological disorders, improper bathroom habits, and emotional stress. Symptoms include frequent or difficulty and uncontrollable urinating, constipation, and straining. Treatments include behavioral therapy and medications. Well guys, I know that was a ton of information to cover in such a short time, but that just about wraps up the video. Thank you so much for watching, and don't forget to like and subscribe, and ring that bell to be notified about my latest uploads. Until next time, this is William signing off.